rabies, what are the animal bite incidence cases in India and its epidemiological status, how the vaccines are evolutionized, what are the changes we have till now, and what are the unmet needs of our people, and newer vaccine called as rabies. And this is
Excuse me, ma'am.
yes.
Ma'am, the live session is started.
Am I audible or not?
Yes,
Yes,
ma'am. Now
madam.
we are
Yes,
audible.
madam.
And the slides are visible or not?
Yes, ma'am. Now
Yes.
it is visible.
Madam.
And in the second slide, whether it is visible or not?
Yes, ma'am. Now that it is visible.
Okay, okay.
Okay, thank you, ma'am.
So, and regarding the phage trials of vaccines, we are going to discuss in detail. Okay. The first, regarding the rabies. So, what do you mean by rabies? Rabies is actually a Sanskrit word derived from the rabhas, means to do violence actually. It's actually a virus, viral disease, which causes encephalomyelitis. And rabies is a zoonotic disease, means it spreads from animal to human being. So it's a RNA virus, and it is having encoded by 5 structural proteins like RNA protein, L protein, P protein, M protein, and N protein, and envelope protein. And among them, G protein and N protein are the very important from the aspect that they induce immunogenicity. Okay, the antibody against it produces in our body, which will be effective or which can protect us from the rabies. So epidemiological point of view, globally we are having death around 60,000. You can see 59,000 per annum. This is the data, I think, from 2018 data. And in India, out of them, 20,000 deaths were occur in rural and urban area. Out of them, 91% are in rural area. So just guess what is our mortality rate in rabies in spite of many vaccines. So some lacunas are maybe there. So though it's a fatal disease, but it can be preventable by vaccine only. Though not 100%. For example, a rabies patient is, we cannot treat them actually. Only conservative treatment will be given. Okay, but rabies is 100% fatal. So we need to give prophylaxis. So basically, we are having 3 types of prophylaxis. One is post-exposure prophylaxis, one is pre-exposure prophylaxis, another is re-exposure prophylaxis. What is the basic difference between 3 prophylaxis? So all of you knew about the how it is transmitted and its pathological. Just I am giving some points about the pathology and how it is transmitted. Basically, it is transmitted from the animal to human being by licks or by bite, or many warm-blooded animals are there that can transmit. So like not only dogs are responsible for only 97%, and rest 2 to 3% maybe cat, goat, tiger, maybe bear, maybe monkey. So many warm-blooded animal, like specifically the mammals, are responsible for it. So we need to give prophylaxis in all animal bite cases. So for bite cases, we have divided according to the category 1, 2, and 3. According to WHO classification, we have categorized 3 categories of bite so that we can treat them. So category 1 is your normal behavior with your pet dog. Many of us are having many pet dogs. So we are normal behavior. So we need not do vaccinate after exposure, but we need pre-exposure prophylaxis in them, like the veterinary doctors, like the dog handlers, those who need vaccination prophylactic. Hello, am I audible?
Yes, madam. Yes, madam.
Okay. So prophylactically, these in category 1, they need pre-exposure prophylaxis, like veterinary doctors, foresters, dog handlers, municipality persons, those who are handling with dogs, dog sterilization. Okay. So in category 2 means you are nibbling on uncovered skin. So that is under category 2, nibbling on uncovered skin or minor scratches without bleeding. So in this case, we need vaccination, means post-exposure prophylaxis. But in category 3 includes the bleeding. If any bite, any scratches with bleeding, then we are having 2-drug regimen like vaccine and plus immunoglobulin, means active vaccination and the passive vaccination. Both we will require. So the next slides. Before going to the rabies vaccine proper, we need to do how we can treat. So before treating according to category 1, 2, and 3, okay, we need the first aid, which is very important. We need to wash the wound properly for 15 minutes in running tap water with soap. This is the foremost thing, so that we can wash out 90% virus from the wound side. So in peripheral setup, many doctors are there. They are not advising washing, but we should focus on that. This preliminary treatment can wash out virus from the bite side about 90%. Okay. So this is the first most thing. And we need to take history, whether that person is vaccinated previously or not. So this is very important point to decide which category they are, 1, 2, or 3, and how we can treat depending upon their previous immunization. So in category 2, vaccine is only required. In category 3, where bleeding is there, if mucous membrane contact with the person, for example, I've given you a very true incidents. For example, one doctor's child have gone to a zoo, and due to sneezing of the beer, they are exposed to their mucus, and the child should take as per the category 3. Because their eyes are mucous membrane, they are exposed to their saliva, because this virus is present in saliva of a rabid animal. We don't know the status of that beer, but we need to give prophylaxis, post-exposure prophylaxis. So in that scenario, we need to give the vaccine plus immunoglobulin. Okay, so various vaccines are there from the era from 1885. Previously, we are having nervous tissue vaccines or neural tissue vaccines. Then many liquid preparations are there, freeze-dried from to liquid preparation. Now very cell cultured vaccines are there. But right now we are having G protein, which is a subunit vaccine and very effective. So why we focus on that? Some current challenges are there due to compliance. Okay. So this compliance is very minimal due to various doses, like 4 doses, like many varicose culture vaccines we are giving in a 4 doses, like on day 0, day 3, day 7, day 28, and many thick embryo cell culture vaccine or duck embryo cell or human diploid cell culture vaccines are there, where we need to give 5 injections. So in spite of availability of these vaccines, why some 20,000 deaths were occurred? Maybe due to incompliance. So compliance is very difficult for up to 1 month. Many factors are there. For example, because of lack of awareness, they don't know the completeness of immunization. The people don't know the importance of completeness of immunization. The second thing, the health facilities are not near to the people. Okay, and they don't know about the schedule regarding. They are not many doctors who are treating. They are not focused on that. This need to be fulfilled. Like up to 28, that didn't. So this rabies vaccine we have developed, the Cadila has developed, under which we are only having 3 doses. Day 0, we need to give 0.5 ml intramuscularly, and on day 3, on day 7. But all the other vaccine, like in government setup, we are giving intradermal regimens on day 0, day 3, day 7, day 28. On that is intradermally we are giving 0.1 ml ID. But here IM on rabies we need to give IM. So the compliance, you can see the lowest compliance are there in 5 injections and 4 injections in this slide. So this is the novelty. So what do you mean by novelty? Means newer thing. So this G protein, which is very important for immunogenicity, developing antibody in our body. So that's why we focus on this G protein. And this G protein was the first 3-dose intramuscular regimen, rabies vaccine, and this vaccine is prepared using virus-like particles. VLP means virus-like particle platform, and nanoparticle, which is engineered to elicit differentiated immune response, which can increase the vaccine efficacy. So this efficacy can be done after phase 3 trial already they have done in many studies will show you. Many studies they show that phase 3 trial has done, and this is the phase 4 marketing phase they are doing. The Thabis is available, ready to use vaccine. No reconstitution is required. Currently, we can replace this Thabis with 5-dose regimen so that compliance will be better. So this is the technology, how VLP G protein isolation is there, and they are capable of inducing a strong humoral and cellular immune response. Then various studies are there, like Dr. Sumit Podar has given a research article, who is the president of our APCRI. Novel recombinant rabies G protein vaccine is there. So this is the study, and here the study designs are there. They can compare. Phase 2 trials have done. Phase 3 also there. Safety, this is another phase 3 trial clinical study, which is a multicentric study, which engage more patients as compared to phase 2. This is a randomized comparator control multicentric study. So on phase 3, they have they have proved that this is very effective, because we have conclude the efficacy of this vaccine under phase 3 trial. So these are the study design. Their objective is to seroprotection level if 0.5 international unit per ml, and that much they have done. The subject with seroprotection at the 14 days, they will identify, and 0.5 international unit per ml they will get, and from this we can know that the vaccine is effective. And the secondary objective in many studies, subject with seroprotection at day 42 days also they have tested. Then they find that this level is maintained 0.5 international per ml. This is the protective, seroprotective level of rabies viral neutralizing antibody. And the result, safety, efficacious. I am not going in detail because you can see the graphs. So mild adverse effect may be there, but that is very low as compared to other vaccines also. You can see the bar charts are there. You can see the green one is Thabis and others are other vaccines. And the side effects are there, but very low. Like I have also given in our people Thabis, but some mild headaches are there and some side effects are there. So these are the thing about the rabies, but specifically I'm focusing on the history status, because if someone, I think this rabies can be given to 18 to 65 years adult patients, we can give, and on 0.37 day, we can give 0.5 ml intramuscularly. And before that, we should take the history properly, whether they are taking any steroids or what, whether they are in anti-malarial drug within last 7 days, this, whether they are vaccinated previously. If they are vaccinated within 3 months, no need of any vaccination required if they are exposure. Beyond 3 months, they need only day 0 and day 3, 2 doses are required. Okay, on 0.5 ml intramuscularly, only 2 doses are required, 0.3 if they are previously vaccinated. For example, at 5 years back, someone is vaccinated with other vaccine. Yes, right now only 2 doses is required. Even if they are in category 2 or category 3, no need of immunoglobulin is required. So this one is history. Second is the vaccine. Third is the immunoglobulin in case of category 3 white, and other antimicrobial treatment is also required in case of severe white. Another important thing is TT immunization, because many patients have not taken many peripheral setups. They come to us and they have not taken TT immunization in a proper way. In severe white also, we can give tetanus immunoglobulin also. We can give along with that. And TT doses should be in a proper dosing schedule. So for an unimmunized person, TT dosing, we need to give 4 doses. Actually, in a gap of 1 month and 1 year and 5-year interval. Actually, those who are unimmunized to TT schedule. So we need to give even the dogs bitten by or any person or cat bite. we need to give a TT provided they are not vaccinated. For example, a 16-year boy will come to our OPD and they will be bitten by, for example, any dog bite. Then they will require, they don't need any TT vaccination because they have taken at the 16 years already they have taken. So we need to take the history from the patients regarding the TT immunization, regarding the previous vaccination of anti-rabies vaccine, and we need to give as per the protocol category 1, 2, and 3. But first it is mandatory vaccine in case of category 2. Category 3, we need to give vaccine plus immunoglobulin. And this is the newer vaccine, which is very effective, Travis, which is a subunit vaccine. And previously we are having cell culture vaccines, nervous tissue vaccine. Many side effects are there in nervous tissue vaccines. And here in studies, we can see the various mild effects are there. And Thabis was a non-inferior to reference vaccine, means many chick embryo or human diploid cell culture vaccine having less adverse effect. This is the novelty because it's a G protein and subunit vaccine. This is the newer one. No subunit vaccine is available in the market till now. And we thank to Cadila for developing this new vaccine. And this is under 4th trial. And we are giving. They are awarded with certain Golden Globe Tiger Awards innovative product of this year. So this is all about regarding the rabies, and thank you for patient listening. And over to you, Mr. Satya.
If there is a doubt come from a doctor, that
Okay.
if a patient has been administered with some other vaccine as dose, and he can be treated with service 3 dose, or he will be treated with same vaccine what he was given.
Yes.
मतलब
For
मैडम
example, yes.
जो
like,
वैक्सीन ने नहीं थी
they have someone have taken on day 0 and day 3 on another vaccine. Okay, we should continue the same product. We should, if in case of non-availability, we can give other vaccine also. We can give in case of non-availability, but we should continue the same brand. We should continue the same brand. But in case of non-availability, we should not continue the schedule. We have to continue the schedule with other vaccine. We can also. We can add other vaccines also to complete the schedule.
Thank you, madam. Thank you, thank you. Madam, if a vaccinated dog bites to the patient should be vaccinated or not?
Yes, yes. Irrespective of dog's vaccination, we need to give vaccine to the human being because we don't know the status of that dog or pet animal, whether they have vaccinated properly or not in an adequate manner, whether they have taken booster. We don't know about the status. Irrespective of pets vaccination, whether they are vaccinated or not vaccinated, we need to give to all human beings, those who are bitten by dog or cat.
Thank you, madam. Thank you, madam, for valuable time. Thank you so much, doctor, for the informative talk. We truly appreciate your efforts. Last but not the least, we would like to inform you that Thabis has won 2 prestigious awards in innovation category, ET India Pharma Award and Golden Globe Tiger Award. Thank you so much, madam. Thank you for your precious time. Thank you, madam.
Okay, thank you.
Madam, you can log out now.
Okay.